Esizela, a remote area in Zululand, nestled away between rolling hills and valleys in the Zulu kingdom. Here Alson Mngwango has raised his 9 children. But tragedy struck when his eldest son died unexpectedly from what he says was flu-like symptoms. They performed a traditional burial and washed the body. But Mngwango says after the funeral, the family received information that his son had tested positive for coronavirus.
He has been complaining about headache and body aches before he passed on. When he died, we fetched his body, washed him and had a ceremony. But after the funeral, the nurse informed us that my son tested positive for coronavirus. They then tested us all in the family to see if we had been infected and told us to isolate. Now we are waiting for the results.
The wearing of facial masks are still taboo here in rural Zululand, as is the simple act of washing hands, as there is no running water. Traditional leadership say the number of people dying of COVID-19 symptoms is concerning.
Come to my surprise on Monday when I arrived at the traditional court, when I signed the certificate of 13 people which they passing between the day of Friday and Saturday. The reason why, when I asked the people why that people are not going to the hospital, they said to me, they take it just a flu, was not a real disease. But after that, they already passed away. After 2 days, they already passed away. Even I'm pleased to the people of South Africa, specifically in my area, because some other people, maybe they follow the correct roads. They must agree when they're taking the dead body from the hospital or from the mortuary to straight to the graveyard, just trying to prevent that virus to be spread.
Apart from non-compliance with wearing of face masks and practicing social distance, some community members say that a lack of water in the area also contributes to the increase of infections.
Our people are dying. This coronavirus is here to kill people, is here to kill us. We must respect the lockdown regulations. What our president has said, we must stay at home. Only go out when it's necessary to go out. This is not a joke, it's not a game. People are dying. I know that now because my mother has passed on. I'm worried though. I'm very, very, very worried because I can see that the social distancing and the regulations are not being followed the way they're supposed to be.
I lost my mother. She was sick for 2 days and I really tried everything to help her get better, but she passed away in my arms. I hope that government helps us with PPEs and testing facilities. It's painful to lose a loved one to this virus.
Many local clinics in the area are not equipped with COVID-19 testing equipment. Traditional leaders have met with families of suspected COVID-19 cases, urging them to isolate, but even this is difficult in homesteads. A call now for government to prioritize the Zululand district.
We are seeing the COVID-19 positive cases increasing significantly in Zululand. Our major appeal to the Department of Health is to say every rural clinic must have testing capacity, because our people who are showing symptoms of COVID are arriving at the clinics, there is no testing capacity. We are really appealing that the Department of Health ensures that every rural clinic has the capacity to test, so that if a person is found to be positive, he is not allowed to go back into the community, but is immediately quarantined.
Local government has called on rural communities to practice social distancing and refrain from large gatherings, including mass burials. But as the virus continues to extend its reach around the residents of Zululand, many wonder how they will cope when it reaches them. Jayed-Leigh Paulse, SABC News, Zululand.